week we're going to be talking about our third observational study design, which is a cross-sectional study. And to illustrate a cross-sectional study, I sent everyone an article to read, which is The Effect of Geography and Geographical Access on Under 5 Mortality. So just background on this study. A little is known about access to health centers and mortality. There have been studies in urban areas that show the further you are away from the health center, the more likely you are to have an under 5 death. But the question here was whether or not that's true in rural areas as well, if there's that same relationship. And they don't know the interaction between distance and wealth. So what is the interaction? If I live far away, do I have an increased risk? And does it matter if I have a lot of money or little money? So what was the primary objective for this study? What were they trying to do or achieve in this particular study? What is the relationship between distance and under 5 mortality? And they were particularly interested in rural Ethiopia, right? So we might know the relationship in urban areas, but does that relationship apply if you're living far away from town? Maybe in rural areas, everyone has poor outcomes, and distance doesn't matter. Or maybe in rural areas, distance is very important in terms of outcomes. So they had this cross-sectional study where they included the 10 areas in rural Ethiopia. And they limited the studies, in this case, only to the 3 rural areas because that's where their primary question was, is the effect of distance on under 5 mortality in the rural areas. They collected full birth history. So they went in and they interviewed the mothers and they asked the mother, how many children have you ever had? And the mother says, 4 children. And then they say, tell us about the last child. Tell us about the birth. And is that child still living? And if not, when did that child pass away? They collected characteristics of the mother. Tell us about your education level. Tell us about can you read and write? Tell us about your health-seeking behaviors. And then they ask questions around household assets. So they're trying to get from this an assessment of wealth, exactly. Do you have cows? Do you have sheep? Do you have a car? Do you have radios? So they're trying to see how wealthy is the household. Now we talked about distance, the effect of distance on the household, and they collected 3 measures of distance. So distance to the clinic, actual. They went to the mother's house, and they walked with the mother while carrying a GPS to see how long she walked. How long was that distance? They did distance as a straight line. So the mother lives here. The health center is there, and if you drew a line, how far is it? And then they did time to clinic. And this one they did using software. So they took the path that they walked, and they estimated how long it would take for her to walk from this point to that point. And then she gets on the moto. How long does it take on the moto to get to the health center? So they tried to get an estimate of time to clinic. So these are their 3 measures of distance. So it makes sense to think about that these 2 would have the biggest impact. So why would we ever use this one? Alice says, I think it is the time that it takes. Or Alice says, I think it is how far it is. So why would we ever use straight line distance? So one possibility is people may assume, you can assume that these are proportional. This line is, it means proportional. So you can assume that if the actual distance is far, then the straight line distance is far. And what Eileen is telling me is actually you could have the same straight line distance, but if this person has a mountain in the way, they have to go much further. Okay? So that is one thing. They can assume that they're about the same, but why would they use the straight line distance? I think it's so obvious that you're missing it. It's easy to calculate. So people use this all the time because it's easier to do. You're telling me you think this is better, but people use this because it's an easier measurement to get. And the question here is, do they measure the same thing? So will we see, if this assumption is true, that they're proportional, if you live far and then the actual distance will be far, so they should relate together, then it doesn't matter what you use. So in this case, they were looking at the relationship between distance and death, and they were calculating rates, the rate of death in those who live far. So this is rate of death. We oftentimes use, it looks like an upside down Y. It's a lambda. We oftentimes use lambdas to represent rates. So this is the rate of death in those who live far. And they're comparing it to the rate of death in those who live near. So they have those who are far and those who are near, and they are comparing the rate of death in those two groups. And they are using what we call a rate ratio, comparing the rates of death in those who are far to the rates of death in those who are near. If the rate ratio is equal to 1, what does that mean? There's no difference in the rate of death between those who are near and those who are far. Okay, so I'm going to compare my rate ratio to 1. If it's equal to 1, then I say there's no difference in the rate of death between those who are near and those who are far. If it's greater than 1, that means the rate of death is higher in those who are far. And what if it is less than 1? Lower for who? For those who are far. Okay? So just like all of the other ratios we have looked at, if the rate of death in those who live is higher in those who live far, then your rate ratio will be bigger than 1. If your rate of death is lower in those who live far, then your rate ratio is less than 1. Now I'm going to ask you a trick question. And I don't want you to say the first thing that comes to your mind. I want you to say the second thing that comes to your mind. Okay? I just want you, a lot of you react to this really quick. So just pause for a second and think. Is it significant? In order to say significance, I need to see a p-value, or I need to see a confidence interval. Okay? So I can say, is it higher or lower risk based on the risk ratio, but to say significance, I need to see a p-value or a confidence interval. What do I need to see in a p-value to say that it is significant? If I show you a p-value, what do you need to see to say it is a significant relationship? So what about 0.05? Less than. So if p is less than 0.05, I can say it is significant. Lower or higher based on the risk ratio, but I can just say it's significantly different. Okay, this one's much harder. What do I need to see in the confidence interval to say that it is significantly different? So if the confidence interval does not cover 1, then you can say that it is significant. For non-significant, so when I say no evidence of a difference, So it's just the opposite of this. So I say no evidence of a difference if p is greater than 0.05 or if the interval covers 1. Okay. So using this, I want you to look at Table 3. So Table 3 is the main set of results in your paper. And Table 3 is looking at the relationship between the different measures of distance and the risk of mortality. So based on this, what things matter for mortality? And then the bonus question is, they said that they adjusted the models. Why? What does that mean to adjust the models? Why did they adjust?